Good morning, I am Dr. Erez Dayan, and I'm here with Kelly Smith, CEO and founder of Projected Growth Consulting. We're very excited to have you.
Thank you.
So tell us a little bit about your company and what got you interested in it.
You know, my background was a business consulting position, and I opened my own med spa in '99, and I had such a great time with that, and it was a 7-figure business in the first year.
Wow.
And after running that for 5 or 6 years and having that staff of 20, I sold it for a profit and then went into consulting. I love sharing what works and helping people grow their businesses, especially in that I've been there and I really understand what it's like.
Interesting. Well, you know, as a young plastic surgeon, doctors and aesthetic professionals know a lot about their area of expertise, but what I've learned is that we really don't know a lot about all the business components, marketing components. There's so much to know that we're not trained in.
Yes.
So what kind of services do you offer, or what's your advice to someone coming out into the aesthetic market?
Well, it's a lot easier to start the right way than correcting, right? But we work with about 50 clients a month nationally, and we do everything from on-site events to financial planning, marketing strategy plans, and a lot of it is done virtually. And so the top 10 problems that I find, that's why I wrote the book, Top 10 Profit Killers, is really those areas that you can either fix or avoid altogether. So a clear financial plan, how to motivate your staff and define their positions, how to set them up for success, as well as marketing, social media, and investing in your people. Because when you create the right team and they're really working for you, it's a lot easier to successfully run those companies.
Absolutely, absolutely.
Yes.
I'm actually excited to see to read this book myself. Could you tell us a little bit about it and what made you want to write it and sort of the background of it?
Sure. Well, I've been in the industry 20 years now, and after helping thousands of offices, you see the same trends as far as what's going on, and it occurred to me that, gosh, we write these annual marketing plans in a 45-minute session all the time. And the more I thought about it, I thought, you know, these are really 1-hour solutions for the top 10 problems. And we measure everything we do. I'm all about the implementation, because you can read about what to do, and many times we know what to do, but it's the getting it done that's the challenge. You know what to do, but finding the time and a method to get that done.
Absolutely.
And so my goal with this book is, whether it's financial planning or staffing and growing your staff or creating an annual marketing plan, that each chapter is kind of a 1-hour solution in order to create that strategy, and then of course you work at implementation. But diagnosing the problem is the first step. So we do a lot of self-assessments, and this book is the top 10 challenges, and so you rate yourself so that you can prioritize, what do I really need to start with? Because you can't fix everything in a business all at once, and it shifts and changes over the quarter. So my goal is to take a look at it and see where you should really start, and then pick one at a time.
Well, that's great. I mean, I think that looking at it as a 1-hour solution to the top 10 problems in particular is really useful, because our lives are all so busy, and you really need to just get in there and target the issue and target the solution. What's your favorite part about consulting?
Getting to meet so many amazing people and help them grow their businesses. I love growing my staff. The better people they are personally as well as business, the more they can help other businesses. And so it's wonderful to watch a business grow 30% or more in 90 days and to fix those problems that they've been struggling with for a long time. Just like as a doctor, it's that intake, it's the H&P. What do they really need? And giving them a way to fix it quickly, there's so much thankful and gratitude, and it's just really rewarding.
That's excellent. And what spectrum of aesthetic professionals do you work with? Is it mainly doctors? Is it nurse practitioners? What's your kind of cohort?
Well, we work with plastic surgeons, dermatologists, med spas. We work with a lot of non-core that move into elective. As we know, that's happening a lot. And we work with the staff as well, but it's a lot of times with the owner and the marketing manager, the office manager. We do a lot of sales training as well. We have online courses, because staff training is a really big issue, and it's rinse and repeat. And one of the challenges is we forget to do that regularly. So that we work directly with staff and with the patients, closing consultations. So
that's
everybody,
wonderful. Yeah,
from A to Z.
I'm excited about talking to you after the show.
Absolutely.
What would be, a couple pearls of advice that you could give someone starting in practice? From a selfish standpoint, I'm curious to see what you would suggest.
Absolutely. Well, I think, really taking the time to create a clear plan. And a lot of times we're moving so fast that we don't do that. And I agree that in med school, you want to help patients.
Right.
And so sometimes the finance business, the marketing, finance, and operations are not your strongest area, and we all avoid what we're not totally comfortable with.
Right.
That's natural, right? So a clear plan, at least for revenue goals, and to look at what you're doing on a weekly basis before the month is over, because profit and losses are a historical account, and you can't change anything. And then the other part that I think is so critical is clearly defining the roles for your staff so that you can hold them accountable and make them successful. In a small office as a startup, a lot of times we only have a few people and we want them wearing all the hats.
Right.
And we don't take the time to define, so they step on each other's toes, and sometimes there's conflict, and it's usually a lot of female staff. So if we can take the time to provide the clarity of here's where we're trying to go, here's your role in doing that, and I'm here to coach you and make sure I've got you in the right spot. And if you don't have them in the right spot, then it's your job to move them to the right spot and capitalize on what they're really good at. We don't take a scrub tech and because they have extra time, put them on the front desk, although we see that a lot, and then we're shocked that they don't like people and they're not very friendly and they're not outgoing. Well, if you really love being a scrub tech, you don't really want to be dealing with people all the time.
Right.
So assess who they are, don't try to change their personalities because that's not going to work. So you just get to be a better person at deciding who's really naturally a fit to the position and then help them be successful.
I mean, your advice really resonates with me because, for me as an example, I spent almost a decade training in medicine, and we get really good at that, but doctors in particular don't always understand that skill set is not always transferable. And when we work in other practices that are already mature, they've already worked out all those kinks.
Yes,
and
there's
you take
a lot
it
of
for
things
granted.
going on that you don't even realize are happening.
Right, and in many practices, unfortunately, there's a lot of turnover for the exact reason you're saying. The goals are not well defined, the employees aren't really sure what they're supposed to be doing, and it's really the responsibility of the person in charge to clearly define the role and goals of everybody.
As much as we don't like it, the stranglehold on any small business is the owner's capacity and where they're at and their skill set. So you don't have to be good at everything, but you do need to hire people that complement those areas that maybe are not an interest or that aren't your specialty. So having a really good spa manager or facility manager and going through the time with them to create a clear plan, that's a wonderful way to approach it because there is a lot to do to create a profitable practice.
Well, thank you so much for being here.
Thank you.
It's really been an absolute pleasure learning from you and speaking with you, and I'm excited to read your book, The Top 10 Profit Killers by Kelly Smith, CEO and founder of Projected Growth Consulting. Thank you so much for being with us.
Thank you.
Next, we have Dr. Alexander Rifkin, a facial plastic surgeon from California. We are very excited to discuss a non-surgical rhinoplasty with him. Thank you so much for being with us, Dr. Rifkin.
It's a pleasure, really a pleasure.
So I have to admit, I'm actually a fan of yours for a number of years, and,
cool.
and we're just meeting now, but I know you've been an expert in non-surgical rhinoplasty for some time now. I think when I was a resident, I saw a television show, it might have been Doctors or something like that, where you were discussing non-surgical rhinoplasty.
Yeah.
So tell us a little bit about what got you interested in it. And
Well, so my background is in head and neck surgery, and as I got out of residency, just all of these tools started coming on the market, and so we had access suddenly to these injectables that provide us, and I saw that you could provide us really with results that were remarkable, especially in a place like the nose, where just a little bit of volume in the right place, you can lift a tip, you can camouflage a bump, and I'm like, gosh, I can get this result without having to cut this person. This is amazing.
Right.
So it's really been a great ride. So for over 15 years, that's what we've been I've focused a lot of my practice on that. And it's just every time somebody comes in and they're like, well, I've had a rhinoplasty and it didn't quite turn out the way I wanted it to, and I just wanted to to become, my nose doesn't look quite natural, I don't know what to do. I'm like, look, 5 minutes, an injection, and you can have a straight nose. And they're like, wow, this is so cool.
Right, yeah, I totally agree with you. I think it's a remarkable technique. It's interesting because for plastic surgeons and facial plastic surgeons, we are trained by the gurus, the senior level people who didn't really do a lot of non-surgical rejuvenation. So I think oftentimes it's kind of looked down upon or it's just something we're not trained in. So I know you've really pioneered this area. Who would you say are the best candidates for a non-surgical rhinoplasty?
So I think that one thing that the procedure can't do is it can't reduce a nose, right? It can't make a nose actually smaller. It can make a nose, interestingly enough, look smaller. Right. Because when you add to it and you make it straight, it actually looks smaller, it blends into the rest of the face. So when you have a bump or you have you have a feature of your nose that attracts attention, it looks bigger. You make that feature less prominent and your nose actually looks smaller. So the patients that that like that with a little bump or maybe a little bit of a tip that comes down, or after surgery where a little bit of filler in just the right place can make a nose that looks operated on really look quite natural. So those are kind of the best candidates are the people that have mild to moderate kind of contour things that we want to fix, and with filler, it works really nicely. Excellent. And the nice thing is that people think about this kind of thing as a temporary procedure, but we have a lot of tools. So we have these fillers that are pretty long lasting. Look, I can get 2 years or more out of Voluma. Right. You can get like 10 years out of Bellafill. It's great. So there are options.
The armamentarium seems to be growing and the products are getting better and better. Yeah. What is your product of choice, or does it depend on the clinical scenario?
It depends on the clinical scenario. A lot of times I'll use Voluma just because it's reversible, so that gives people peace of mind. Right. It's natural looking. It lifts pretty well, and it lasts a super long time. If you can get, I usually schedule it where I have couple of touch-up procedures built into the to the package. So the patient comes in again at 1 month and comes in again at 6 months. Usually I can get them lasting more than 2 years with that. Right. So that's pretty good. And then when people want to transition then over to a more permanent filler, then we use Bellafill. But the nice thing about these kinds of Voluma is particularly with Voluma, is that I can put it through a very, very tiny syringe, very, very tiny needle. So the discomfort's really pretty minimal. Right. The risk is minimal too.
That's the amazing thing I think about it. The cost is much less, the downtime is pretty much, insignificant. Yeah. Especially compared to surgical rhinoplasty. We do a lot of surgical rhinoplasty, and I think it's, for a lot of patients, especially attractive young men and women, who may not need, an open rhinoplasty approach. Anytime you touch someone's nose, there's swelling, there's downtime, bruising is unpredictable, as hard as we try. So I think it's a great technique. Do you use it sometimes? I'm curious, if you have a surgical rhinoplasty candidate, do you ever use it for patients to try on their nose, meaning, this is what it would look like if your hump was camouflaged, and see if they like that before going to a surgical approach, or does that not happen very often?
Generally not. Generally the people that come to me are the ones that really don't want to go to surgery. And sometimes I have actually I've stepped away from doing surgery these days, so I have a colleague that'll come in and do the surgery. So sometimes people who aren't candidates, we have that option. But most of the time people come in, and the interesting thing that I've learned is that as surgeons, we look at patients and we want we want to deliver the optimal result. We want to deliver the perfect nose. Every time we want to always have the perfect nose. But the interesting thing is that patients sometimes come in, they're like, well, I don't want a perfect nose. All I want is this little thing correct, and I want something very precise and very specific. And this is a technique that can really deliver that kind of thing. And I've been surprised that patients come in for something, and I'm just like, I don't know this is the right procedure for you. I don't know this is going to do what you want it to do. Right. And they're like, you know what? I don't care. A little bit of improvement, and I'll be happy. And that's great.
It's so interesting you said that. Yesterday I gave a number of talks on energy-based technologies and minimally invasive treatments, and this is very similar because I think you're right. The patient population wants minimal downtime, minimal pain, back to work. Everybody's lives are getting busier and busier, and with social media and all these other pressures, people want to get back to their lives, and it doesn't have to be per se a home run result, although I'm sure I've seen your results. I mean, many times you can't tell. I mean, I'm amazed. I mean, if somebody has a dorsal hump, instead of going in there and rasping it down, if you can camouflage it with filler, it's reversible. It can last 2 years. I think that's pretty amazing.
Yeah.
Any safety pearls you have? The nose as far as vascular structures go and things like that.
I think when you're, we're addressing this to consumers out there.
Right.
When you're looking for somebody to do this kind of procedure, you always want to, in any kind of procedure that you want to do, you always want to find someone who does this on a regular basis.
Right.
You know what I mean? So you want to ask, how many of these do you do? How often do you do them? Can you see before and after pictures? And you want to come to them from a recommendation, from really and there's no shortcuts to doing your research and really finding, because the nose, it is a feature in terms of anywhere that we inject on the face. It is something that's a tricky place to inject and can have, we can have issues with it. So you got to do your research. And for practitioners, train, get experience, know your anatomy, and that's something that,
Absolutely.
It's a great procedure.
Absolutely. Just because it's minimally invasive does not mean that it's risk-free.
That's
and
for sure.
Going to an expert that really knows how to inject, where to inject is critical, because as these injectables become more and more available, there's a whole spectrum of people injecting them. So particularly in the nose, where you can get into vascular structures and get into pretty severe complications if you don't know what you're doing. It's important to go to someone like Dr. Rifkin who really does this on a regular basis and has great results. So thank you so much for joining us.
No,
it was
my
really
pleasure.
a pleasure. And
pleasure. Thanks for having
Thank
me.
you.
Really,
Thank
thanks.
you. Next we have Dr. Cusilano, who is a board-certified plastic surgeon from Oklahoma. We are going to be discussing butt augmentation and buttock aesthetics. Very nice to have you.
Thank you.
Thank you. Thank you for being here. So tell us a little bit about your practice and kind of your interest in buttock enhancement and how you've grown that area.
Okay. Well, I've been in practice for 21 years, and I do nothing but cosmetic surgery, and it's about 70% body, 30% face. But when I first started practicing, some bariatric surgeons approached me for doing a lot of post-bariatric. And so my practice started doing a lot of that, which included butt lifts. So I did a lot of formal butt lifts, and then of course things have progressed now. You have Jennifer Lopez, Kim Kardashian, and so instead of just doing the standard formal butt lift, people want bigger butts. So of course I started doing fat grafting, gluteal implants, and so now I do for the last 20 years, full range of buttocks implants, buttocks with fat grafting, and still formal lifts as well. So I love doing all of it.
That's great. Yeah, I mean, as we've seen in plastic surgery, buttock enhancement has skyrocketed in popularity. And along with that, we have many different practitioners using different techniques. They're injecting fat in different places, and there have been concerns over the safety of buttock enhancement. So, it's been popularized in the media. Because as more and more people are doing it, there are complications in non-experienced hands.
Absolutely,
So,
yeah, you're exactly right. And a few years ago, the plastic surgery study came out, and they had a death rate as high as 1 in 3,000 from fat emboli. So it really dropped the bucket out of a procedure that seems safe, and everybody was doing it, and everybody's still doing it, but they have to understand what causes this major complication, because if you get fat in the vein, especially those deep veins, the superior and inferior gluteal veins, people can die within 12 hours or less. And so it's critical to know what you're doing. It can be a very safe procedure if it's done right. But I think what happened was a lot of people were doing it, especially in South America, and they were just using cannulas as deep as they wanted, going deep in the muscle, and they injured the veins, of course, and they had that terrible complication. We started seeing it in the United States. And what I've noticed lately is that the good news is the trend is going back where it's safer now, or it appears to be. In a study I recently did, it was close to 1 in 4,800 about 3 to 4 years ago. The newest study so far, it was 0 in the same group of doctors, which probably implies the doctors finally learned, hey, we don't need to be going in the muscle. If you stay above the muscle, you don't aim the cannula downward, it can be a safe procedure.
Right, absolutely. Yeah, we looked at some of those anatomic considerations as well, and I think you're 100% right. Beforehand, people were just because it's a cannula and it's minimally invasive in a sense, doesn't mean it's always safe. So I think people were putting that cannula kind of wherever and putting it in muscle. And as you said, this was very popular in South America, in particular. What's that saying? Cheap plastic surgery is never good, and good plastic surgery is never cheap.
That's right.
And so a lot of times when people are, maybe looking for less expensive options, going to Mexico, Dominican Republic, there are good surgeons there, but there are definite areas where you can get into trouble if the practitioner doesn't know where to inject and what they're doing.
Right.
So what's your main patient population? Who usually comes to you for buttock augmentation?
Well, it's interesting. I'm in Tulsa, Oklahoma, and about half of my patients that are getting Brazilian butt lifts are Hispanic or Latino.
Okay.
And then about 25% are African American Black, and then the other 25%, mostly Caucasian, but a little bit of a mix. But I give a lot of lectures on ethnic buttocks augmentation. And the reason why, those three groups, African American, Latino, and Caucasian, all desire a slightly different shaped buttocks.
Right.
And if you give a Latino a Caucasian buttocks, they're not going to be happy with
right,
you. So,
right. Yeah, that's why I ask you, because just like you said, the buttock aesthetics, we're beginning to define it more and more, but there are many anatomic considerations as far as where the hip is going to be most wide. Are you going to put most of the volume in the most projecting area or higher? And I think that's, just like you're alluding to, it's very, it depends on the ethnicity and the desires of the specific patient.
Right. In general, an African American will want a little bit higher over the midline portion of the buttocks. Caucasian, more in the midline, general round. The Latino wants a little in the lower third, and especially the outer, sort of in that greater trochanter depression. So you're giving them a little bit wider buttocks than you would a Caucasian.
Uh-huh. And what's your preferred technique? Do you prefer fat grafting or implants or combinations, or how do you decide that?
Yeah, I like them all, but of course, the fat grafting usually is going to be great if the patient has adequate fat. And of course, if they have fat in their hip area, they're going to get a great result no matter what, because you're making their waist smaller. That's always going to make a buttocks smaller. So I play it by ear on what the patient wants, their needs. And if they come in and they really just don't have very much fat, we'll go to the gluteal implants, which I do love. I think they're wonderful. There's some advantages to the implants in that you don't have to worry about resorption.
Right.
You don't worrying about fat emboli. If you put it under the muscle, it can look very natural and normal. It is a little more sore, compared to the fat grafting, but I like them all.
Right, yeah, I think implants kind of got a bad rap early on. I think they were less sophisticated devices, and now as it's come back, it's kind of come back into popularity because there's a certain projection and look with an implant that it's hard to match with fat grafting, and I know people are combining it.
Yeah.
What do you usually tell patients about downtime?
Well, I tell them for the Brazilian butt lift, the fat grafting to the buttocks actually usually is not the sore part. It's usually the liposuction. So if I'm doing more liposuction, their downtime is going to be a little bit longer. I've been using a lot of medicine like Exparel, some of these long-acting numbing medicines.
That's great.
And I tell you what, it's really improved the recoveries for tummy tucks, especially for butt implants. If you inject all around the muscle with some long-acting numbing medicine that gives them 3 days of virtually no pain, they get back into things quickly where they can go back to work certainly within a week.
That's great of you. Yeah, Exparel, for those who don't know, is a liposomal bupivacaine, which is a long-lasting numbing medication. Lasts, I think, 3, 4, 5 days. I mean, it really gives patients a lot of comfort. So, thank you so much. It's really been great learning from you and hearing about your technique. Thank you. Thank you. Next, we are going to have Dr. Leslie Bauman from the Bauman Cosmetic and Research Institute. We're very excited to have you here. Dr. Bauman, pleasure to be with you.
Thank you so much for having me.
Thank you. So tell us a little bit about your skincare work and what you do a little bit.
Well, I do a lot of research on different skincare products. I don't have a skincare line. I'm so passionate about skincare. I write a lot of articles. I write one for Dermatology News every month on ingredients. I have a couple of books on ingredients. So skincare is really my thing. So I'm here at the Aesthetic Show talking about how to design a regimen.
Well, that's important. I'll tell you, as a plastic surgeon, many people assume that we know a lot about skincare. And the truth is, we don't, as plastic surgeons at least, there's so many products, there's so many companies and marketing, and it gets very confusing. So what would you tell, what are the kind of the key components of a good skincare regimen?
Well, the first thing is there's no one skincare product that's right for everybody. You know, the companies would like for you to believe that this product is going to be great for everyone.
Right.
And the second thing is there's no one regimen that's right for everyone. So you really need to look at your patient, figure out their skin type, and then design that regimen for their needs. And I don't believe that it should all be one brand. I don't believe it should be the same for everybody. So my lecture today was about each step, like what do you need to look for in a cleanser, and how does the cleanser prep the skin for the next thing, which is the treatment product, and the moisturizer goes on top, and how does the moisturizer help the treatment product penetrate better. There's so much science in designing a regimen that you really can't do it right there on the fly with the patient. You have to plan ahead.
Right. It's a great point because, you know, many of us, we just carry, you know, a certain line. And, you know, I think you're right. We're all different. And one particular product doesn't necessarily, you know, address everyone's concerns. What are your thoughts about, you know, imaging? Like, you know, I know there's different cameras like the Visia system for looking at, you know, skin imperfections that you can't see with the naked eye.
Right. Well, we use the Canfield CA camera. I love it. I take a picture every visit, and I believe that it makes the patients come back, that they're also excited to see their follow-up. It makes them more compliant because they know that you're going to be looking to see if they use the products. So the way we do it in our office is I have software where the patient takes a quiz. It gives them a skin type. It automatically generates the regimen. They come in, they get their picture made. We match the picture to the skin type, make sure it's all correct. Then we use the camera, the pictures, to go through and explain why we're giving them all the products. And we tell them we're going to be following this number to see if this product is changing the number. And then when they come back in that month, we show them the change. And you can tell when they're using their products and when they're not.
Interesting. Yeah, I think that all the imaging systems have really changed things a lot because now patients can really see in detail and in high fidelity kind of what's happening.
Right, and people, I'm sorry.
No, sorry, go ahead.
People will say that they don't like using their camera because sometimes the camera shows that the products are not working, but really it's not that. Maybe that they didn't diagnose the skin type properly, maybe they didn't give them the right regimen, but usually the patients are not using the products like they say. You know, there's lots of studies to show that 95% of patients underuse their products, and the only way you can improve that is by giving them written instructions. So it's key that you give them a step 1, step 2, step 3 sheet when they go, and that's another thing our software does is it generates that.
That's very important because, like you're saying, I mean, skincare is really a long-term game, and you know, our day-to-day lives are so busy. It's hard to kind of keep that up without written instructions and knowing exactly what to do next.
And it's hard to get your staff to do it for you. So if there's a system where you just push a button and it generates, that's what the Skin Type Solutions system does. You don't have to worry. Like if it's your nurse's first day, she's still going to give the same advice as if she's been there for 5 years.
That's great. Well, I have to talk to you about that more. Who's your average patient? Like who comes to you? Is it the younger patient, the older patient, or kind of the middle ground? Who seeks your help?
Well, my practice is in Miami Beach. I'm a cosmetic dermatologist. We don't take any insurance. So it's everybody from millennials. I think my oldest patient is 101. My youngest is probably about 10 years old. A lot of moms will bring their daughters in to look at their picture under the camera so I can scare them about the sun damage and try to teach them good sunscreen habits.
Yeah, particularly in Miami, I'm sure sun damage is a big issue.
So my goal is really to get everyone in the world to wear sunscreen every single day. If we could all work together and get our patients to do that, we could really lower the incidence of skin cancer.
Right.
But it sounds like an easy goal, but it's actually difficult.
Right. It's a challenge even with my kids. It's hard to get sunscreen on everybody all the time.
Yeah, me
but
too.
you know, there are those pictures on social media showing the impact of sunscreen on facial aging. So what are the basic components of a good skincare regimen, would you say?
Well, there's really 5 components of the AM regimen and 5 of the PM regimen. So it's cleanser, eye product, treatment product, moisturizer, sunscreen in the morning. Same thing at night, except the last step is a retinoid. And so the software takes into account what the skin type is and how the products are going to interact with each other. So what most people don't realize is, for example, your moisturizer, depending on what's in it, can affect the efficacy of everything else. So hyaluronic acid products are very popular. And most people don't know that hyaluronic acid increases penetration. So if you're giving a hyaluronic acid product to an acne patient, they might get more side effects from their acne drugs, the benzoyl peroxide and things like that. So hyaluronic acid isn't a great idea in acne patients. However, you have an older person with really thick skin and you're trying to get the vitamin C in, hyaluronic acid is a great choice for them.
Very interesting. That's very interesting to know.
The order really matters. Like you don't want
Yeah.
to put the moisturizer on first and then the expensive product because it'll impede the delivery of that.
Uh-huh. And you know, you mentioned the retinoids, and I know that that's a very important component. Do you typically give prescription products, or are they typically over-the-counter products? Do you think one works better than the other?
All retinoids work. The key is getting the patient to use them. So I'll write a prescription if they have good insurance or if there's a cheaper option. A lot of times I'll sell retinols in my practice. There's a lot of studies that show that retinols are just as effective. So it often becomes a financial consideration of which one you choose. But the key is getting them to use it properly. So the dose, like how much they use, how often they use, and what else they put on their skin matters. So we train them every third night, a pea size on top of their moisturizer. And then we check with them 3 days after they see us. We actually call them and cheer them on. And then that camera coming in a month later when we tell them, hang in there, in a month we're going to look and see how the retinol's working, that'll often help them be more compliant.
That's great, because there is sometimes some irritation, or at least when you begin using a retinol, some redness or irritation you can get. I think a lot of patients, when they, for example, when they start a Retin-A, for example, that kind of, especially when you're in the sun and in environments like that, can kind of cause them to not continue with it sometimes.
And I'll tell you a little trick is if they don't get irritation, then you have to wonder if the product is really working.
Right.
A lot of these non-irritating retinols really they don't work.
Right.
You know, if they get exposed to light or sun during the manufacturing process, they lose their efficacy. So you really can't believe a product that says that it has a retinoid and it's not irritating. There is some science coming out of some growth factor inhibitors that might prevent that irritation, but they're not out yet. So right now you can measure efficacy by how much irritation they get.
Right,
In fact, in the old days, they used to think it was the inflammation that was causing the anti-aging.
So interesting.
Yeah.
How long would you say, like, let's say a patient comes to you, how long until they notice a difference? What's the, because, you know, now everybody wants kind of like the immediate result. You know, people on social media love seeing the laser and then they love seeing the clear skin afterwards. What's a typical course?
That's really the problem because patients are trained to believe from TV commercials that they're going to see a difference in 3 days or a week. So at their first visit, I tell them, you're going to see me in a month and you're not going to see a difference yet with your naked eye, but we're going to look under the camera and we're going to start to see differences. So in real life, without the camera, it's usually about 8 to 12 weeks when they'll see a difference. If you're treating melasma, it's 12 to 16 weeks. So it's all about managing their expectations and having them stay the course. It's like dieting. You can't just eat right for 3 days and then, you know, lose weight.
Yeah, exactly. There's no free lunch, and it doesn't happen overnight. I mean, this is just, it's so interesting with all these skincare regimens like Proactive and all these systems. You know, people just think they're going to get it in the mail. It's going to fix their problem in a couple of weeks, but it does take time and it does take some expertise and customized treatment.
Right, acne is an 8-week cycle. So I tell patients, if you break out tomorrow, it isn't what we put you on, it's what you did 8 weeks ago.
Right.
And that's another hard thing for them to understand.
We're going to have to come visit you in Miami Beach.
Yeah, thanks, and look for me on LinkedIn because I post a lot of articles and I love to, I want to invite all the doctors to come to LinkedIn and Leslie Bauman because we have a lot of conversations. So there was that new article about sunscreen in the bloodstream and how that was, and we all talked about it on there, what we were going to tell our patients.
Excellent. So. Yeah, we always want to learn more about skincare because, you know, that's the first thing everybody sees.
Right.
So thank you so much. It's a pleasure to have you. Thank you. Thank you. Next, we're going to be going to Dr. Anil Rajani. This is a pre-recorded interview, and we look forward to coming back to see you soon.
Good morning and welcome back. I have the honor and the pleasure of interviewing Dr. Anil Rajani, or I'll say the Dr. Anil Rajani from Portland, Oregon, Rajani MD. I've had the pleasure of working with Dr. Rajani for many, many years in multiple faculties. Dr. Rajani, thank you so much for taking time out of your busy day.
Thank you.
I know that you are the go-to guy for dermal fillers, neuromodulators, and skincare. So if you will, share with me when it comes time to picking and choosing all of these different devices and skincare, how do you choose on which dermal filler? Because I know you're a national trainer.
Yes.
I don't want to mention any specific names, but how do you determine what the best filler for your patient is?
Yeah, you know, I think that's a very interesting question, and it's one of the main reasons why we do a lot of training over the country and around the world, because we're always learning of different properties of these products as we go along, and hopefully we never find any surprises with the products, but it's really the experience with the products. And one of the things that's often hard to teach is each face is different. and the skin texture and the tone and the needs and the amount of lift. And all of these properties are like tools in our toolbox to create the end result. So it's based on experience, it's based on learning from the key opinion leaders and conferences just like this where we're really sharing that information. But it's one of the challenges with more and more products coming to market.
So that brings up another very interesting point. I remember many years ago when I first got into this industry, there was one major neuromodulator. There was one major dermal filler. And then one company entered the market and they brought on another couple of products, and they brought on 2 of the hyaluronic HA products, and then 3, and then another major manufacturer came in and another one became FDA approved for a different part of the face, right?
Yes.
And now there's another one entering the market with one right on its tail.
Yes.
When you are very comfortable with one already, and a new one comes out, whether it's on a jet trial, how do you determine whether or not it's something that you want to go to?
I think each practice is a little bit different, and each practice will evaluate what they're doing, what are the tools in the toolbox that they have, but everyone likes something new, meaning the public and inquisitive injectors or providers. And so those who are inquisitive, they want to try it and see what are the slight differences, the nuance, the time of onset, maybe a little difference in duration. For some clinics, that might be overwhelming to incorporate into their practice, and these are some of the challenges that we have. And then if you look at rewards programs, you don't want to dilute. It's very hard to offer all of the products. So which ones work for you? Coming to conferences like this, doing the trainings, and a little bit of personal experience often can help answer that question.
You know what I found is like when you work with a lot of vendors and they offer different rewards programs, sometimes it benefits you as the surgeon, the cosmetic surgeon, to offer one product over another because you may get different perks and things like that. However, you know, this is a different world today with social media and TV market advertising. And a patient, many times, how often does it happen to you that they come in telling you what they want? Not only do they tell you what they want, but they tell you how many units they want where.
You know, Jay, it's very interesting. I find it's country specific too, because I travel around the world and train in different countries. In some countries, the patient will walk in and sit there, and the physician will just tell them what to do. Here's what we're going to do. They talk very little to the patient. They come back trusting that the provider knows what to do more than the patient. Now with social media, with YouTube, with Instagram, and all the educational platforms online, the public has so much information, and now you see people injecting themselves and learning that online. So it's really, this is uncharted territory, but not unprecedented from other countries. So we're learning with all this, but there's no question, social media has played a big role, and the products are largely available.
Right.
Sometimes it's just about anyone. So it's scary, it's fun, and we're learning how to deal with it, but it's tough.
Right. I know that you've become an expert in the skincare market. In our final wrap up, can you share with me what is your go-to and your takeaway from skincare products and how you represent it and present it to your patient?
Topical skincare? Yeah. I think there are the staple products, the fresh vitamin C's, the retin-A's, time proven, and then you start to get on the fringe of peptides and newer products that we're still learning about. Delivery systems is a very interesting one. How do we get these products deeper into the dermal layers where they can actually work better? So I stick with the basic proven scientific products that work, that we know they're going to produce a great result. When that doesn't work and we need to deviate, then I go to the newer products, the peptides, the snake venom products, to see what, and our patients are using this anyway, and they want all this new stuff. They give us the feedback of what they see. But I'm a bread and butter, start them there, and then branch out as we need.
Wonderful. Dr. Anil Rajani, it is always wonderful as a friend and a colleague to speak with you and learn something new all the time. We go back a long way. It's a pleasure.
I appreciate your time. Thanks for having me.
Thank you so much.
Well, thank you so much, Dr. Rajani, for a great interview. Next, we're going to have an interview with Dr. Michael Gold, interviewed by Dr. Chilukari. Looking forward to learning from both of you.
Hi, I'm Sunil Chilukuri, coming to you live from the Aesthetic Show. I get to be hosting, finally, my good friend and colleague, Dr. Michael Gold. He's based out of Nashville, Tennessee, and you have taught me so much through the years. It's like speaking to my mentor. I love it.
No, thank you. But it's my pleasure to be here.
Thanks for coming. What are we going to talk about today? Should we talk about new laser technology? Should we talk about what's out there that hasn't been published yet? What should we talk about?
Whichever, whatever, a little bit of both.
All right. Let's start with something that's old so we can go to new.
Sure.
I was talking just earlier today, 2 years ago or maybe 3 years ago, you presented a paper where they did a 10-year prospective study talking about how IPL can change or almost stop time. Tell me a little bit about that.
Yes.
Tell our audience a little bit about that.
Intense pulse light is a light source that we've used for years. That term photorejuvenation, photofacial, has been around for a long time, and I was part of that way back when. And so part of what I've done over the years is spend a lot of time, as you know, in China.
Exactly.
And so during one of my travels over there, came across a group that I do a lot of work with in Foshan, China, plastic surgeon named Dr. Peng Chen. And we started looking at some of her data that she had started to accumulate. And one of the things she was doing, and I thought was just revolutionary, was looking at patients that had what we would consider a treatment, three treatments, and they get great results. But then if we actually treated them every year for up to 10 years, what happened with them? And so based on some work that was done here in the US, Patrick Bitter and the group looked at like 10 patients with that, looking at multiple IPLs sort of retrospectively. Sure. And so we sort of said, okay, how many patients in China have you looked at? And we put together over 2,500 patients.
Right, it's amazing.
Which is just unthinkable when we talk about numbers. So we put together 2,500 patients with incredible photography. And then we had blinded physicians look at the photography. And these are people that had been three treatments, then once a year, at least one treatment, and then followed every year with the same 1 or 2 treatments for over 10 years. And what we found was if you did that, there was like a 90% improvement in the skin. So somebody who was 40 at the beginning, 50 at the end, looked like they were 35.
I love it.
And so we published those results, and to me, it's one of the groundbreaking technology treatments that have been published. Because again, we talk about 10 or 20 patients, but when you talk about 2,500 patients, that power, that N, is so important and so big. So I love IPL technology, and part of what we talked about earlier today was IPLs form the basis of every platform device almost that exists out there. And people talk about buying platforms or having platforms, and that's great. Platforms do wonderful things because you can add things to that platform, and various companies have added, whether it's the Cyton Jewel X, they have the broadband light or BBL. Then they have the halo on that, and they have other things on that. So by adding other technologies, Luminous adds the Resurfix, which is a non-ablative fractional, and others add other things. You get the best of all the worlds. Now, unfortunately, if one breaks down, the platform breaks down. But as I said before, in lectures, if you deal with reputable companies, those problems rarely exist. So I don't have issues when the platforms that I have, but I love being able to use my IPL and then at the same time doing a halo procedure, at the same time doing a non-ablative fractional with the Resurfix. So having the technology of IPL, which is so versatile, and all these other platform pieces is the best for me.
No, I agree with you. And I can never forget that day because I was sitting next to my wife as we were presenting, and I think it was either in Thailand or Vietnam, and she looks over at me, she says, Sunil, why are you not doing that to me? And I said, well, you did it 4 years ago, you never came back, right?
Well, and that's
interesting.
And I think the key is we never taught our patients that. We said, okay, here's your treatments, 2 or 3 treatments, you're gonna get great results with an intense pulse light, so your photorejuvenation is great, and come back when you're ready. And now the mentality is, as dermatologists, you and I talk also, we give skincare. It's part of what we do.
100%.
And we want to see our patients and we want to see them back on a regular basis. So why not, if you will, a touch-up at a year, another touch-up at a year. And if we do that and maintain them, we can actually turn back time.
I
And
agree.
part of what Patrick did with a group at Stanford, they did these gene regulation studies and gene expression studies, and they actually showed that you actually transform the genes to younger genes.
Correct.
And so therefore we've got the physical science and we have the science.
Correct.
And so it makes sense.
It makes perfect sense. And for those of you at home who have practices, one of the things that we found is really understanding how to talk to your patient and bring them back. And so based on your recommendation after that, now we say it's like going to the dentist. You need to come see me once or twice a year, and that's just part of what you have to do for maintenance.
Right, and it's like, again, I think the cosmetic world doctors understand. You see a patient for a neuromodulator.
Correct.
Okay, you know you're scheduling them
Correct.
back at 3 or 4 months.
100%.
You know, they may say, I'm not going to schedule now, but you go through the homework or the way we try to educate them, and we want them to come back, and
100%.
we plan for them, and then for 3 or 4 months we remind them that it's time to come back. Well, the same with IPL.
100%.
And if you do it, yeah, it's really a no-brainer.
It's amazing. I don't know if you caught the talk. I gave a talk about 2 or 3 weeks ago. We did a 20-year retrospective study on patients we've been seeing for 20, 22 years, and they look younger today than when we started.
Well, I think if you follow patients and actually treat them when appropriate, when needed.
That's correct.
Okay, I think we also have to be cognizant. Sometimes patients don't need anything.
Correct.
But that's okay. You can go over their skincare routine,
100%.
change it up, make it more with the times if they need new things. But yeah, I think the idea of keeping our patients in some sort of routine is really important.
I agree.
And then again, with maintenance therapy, but with this IPL, it's really revolutionary.
I love it. So for those who are at home, what do you notice in terms of IPL technology saying for the old timers who said, you know, you have to have a pulse dye laser and IPL is not strong enough. You either do pulse dye, you do CO2 or erbium YAG. You and I talk about platforms quite often, and one that we talked about earlier, in addition to Luminous and your Cutera devices, we're talking about like even InMode, where you have a true diode laser that you can plug into there.
Right, and so InMode is another one we talked about, and they have different technologies. So they have what's called Forma, which is bulk heating, RF bulk heating, and I love the combination of bulk heating and IPL together. And they have something called the Lumeca, which is a great IPL. And then they have Fractura built into the InMode, the original InMode system.
Correct.
And that's a microneedling device,
RF
and it's insulated and non-insulated, so whichever one you like better. But that sort of lets you tailor your dermis with the Fractura, and then you can treat the skin and tighten the skin with the other two. And we did a study with that as well, putting all of them together.
It works great.
The combination of 3 is much better than 1.
I agree.
And I do that with the same thing with something that Venus has called the Versa.
Oh, sure.
And so we're doing that with their technologies as well, with the Viva and their IPL and the bulk heating device as well. And so we're working on that protocol. Again, how do we maximize our devices that are together with protocols that actually make sense?
That makes sense,
And again, I think we've done that. Now in the InMode, what's interesting, they now have some newer systems, especially on the microneedling side, called the Morpheus 8.
Correct.
And that is a really deep needling system.
5 centimeters.
Right. So it's kind of the next generation. And again, tumescent anesthesia or local anesthesia is needed, but the results are unbelievable.
And especially because you don't have to go under the knife, and that's what more and more patients are asking for.
And it's not really not a lot of downtime. It's just getting the needles in there.
Correct.
And then the downtime isn't that bad with the Morpheus 8. So I think what we've got and what we've been able to show with the technologies, that you can have these platform devices that have multiple technologies, whether it's the EndyMed with the 3Deep, which is bulk heating, and their microneedling, or some of the others, and you combine them all. And that combination gives our patients some really nice results.
I agree with you. So we talk about combination therapy, and we're going to end with combination therapy. So it's not just what's the newest and latest and greatest things that are out there in your office. It's really about understanding the technology and how to hit it from different pathophysiologic mechanisms. So really, it's such a delight.
No, it's
Dr.
my
Gold,
pleasure.
He's based out of Nashville, Tennessee, and we're coming to you live. I'm Sunil Chillicurry, coming to you live from the Aesthetics Show. Thanks for joining us. Thank you so much
Thanks
for coming.
for having me.
It's a pleasure.
It's always
Look forward
a
to seeing
pleasure.
you again
Thanks.
and learning more. Thanks.
Great to have you back with us. I'm Dr. Erez Dayan here with Dr. Chillicurry and Dr. McCoy. We are going to be talking about some of the newest technology and hottest technology out there in aesthetic medicine, and we're going to be talking about M-Sculpt.
Right.
So great to have you guys with us.
Thank you. Thanks for having us.
Thank you. Tell us a little bit about M-Sculpt and how you got involved and sort of the whole progression.
Certainly. You mind if I go first?
Absolutely.
So M-Sculpt is high-fem technology, high-intensity focused electromagnetic technology, and this got started in the physiotherapy world. Very interesting to see. What we found out is that when we're actually using this device to repair a muscle, there was a side effect, and that side effect was some fat loss in that area, and they were seeing it on MRI and CT when they were recovering these athletes. They thought about it and they said, can we use the same technology to globally enhance somebody's muscle as well as reduce some of the fat? So we started the trials back in 2015, 2016. They got FDA approved in October of 2016, and we're excited about the technology, and I think you were one of the early adopters too. So we're excited about the technology and trying to figure out what can we do with it. And they made us wait another 2 years, over 18 months, 19 months before we can actually launch it. They wanted to get all these studies together. And we've launched a lot of different products over the time, including Cool Sculpting by Zeltiq. And it was interesting to see the company take in really making sure that they had their ducks in a row. So it's really incredible technology. Right now it's approved for the abdomen, for the buttocks. It's a smaller applicator just came out that got approved for the calf earlier last week, and then the arms got approved back in March. So pretty applicable for what we're seeing in Texas. And tell us about Arizona, I guess.
Yeah, it was really a blessing to get involved with the project in the beginning, and I believe I was the second site to get the original prototype. Wow. And it was one of those things, okay, does this thing really work?
Right.
And the thing that was really amazing out of the gate was BTL really did things right by bringing a group of people together to really get data collected and see, okay, one, does the treatment work? Is it safe? How long are we seeing duration of result, and what's the best protocol? Often companies will come to market with a device really quickly, and we have this very conservative protocol, and we have to kind of figure out how to make things work. Where when M-Sculpt came to market and started to be sold, we had a protocol that we knew worked, where we do 4 treatments over a period of 2 weeks. So you're doing 2 treatments a week. And during that time period, we're seeing really nice result quickly with no downtime.
That's great. I mean, I think you nailed it. There's so many products coming out. There's so much marketing, and we're so connected with social media and digital media. It's hard to know what really works and what doesn't, even for the provider. Even if you just turn on your TV, you see the ab sculpting device, and it's hitting you with the so I think in our minds, it's almost sometimes when something's too good to be true, right. It concerns you. And I've seen the M-Sculpt studies, and you can't argue with the CT scan that shows you more robust muscle and a smaller fat layer. So I think that's really an amazing technology. Yeah. Who are the ideal patients, do you think, for M-Sculpt?
Good. So I think it's any one of us on the panel. All of us, we work out, we diet pretty regularly, and it's that next level that you want to go to enhance everything. Everybody wants to sell something as a full package and say, we can treat any size. You can theoretically treat any size, but in my opinion, I want the people who are already relatively lean, relatively fit, or maybe somebody who just had a baby and we want to improve the diastasis recti or the separation of the muscle. So that's my ideal candidate, somebody that's going to partner with me to make sure that they get good results.
I think it's a really good point, because patient selection is really everything, and we can't apply all these technologies to the spectrum of patients, because inevitably we're going to have patients that don't get the result they want. So I think it's an excellent point. Identifying who's going to benefit from what technology and how to apply it, I think, is about half of the battle.
For sure.
I saw that about the diastasis recti. I think, was it Drew Barrymore that went on talking about
she did
post-pregnant, because it's a big issue for many patients. Yeah. In plastic surgery, we see patients all the time who are thin or 100%. Relatively fit, and with pregnancy, the muscles just naturally, the six-pack muscles naturally separate. And I'm a plastic surgeon. This is what we do, but to create a long incision, bring those muscles together is a lot sometimes.
And I think it's interesting also from a non-surgical standpoint what we can do, because we're now partnering with several plastic surgeons in the Houston-wide area to see if we can do the M-Sculpt first. We wait 2 to 3 months, then they go in, they'll do an abdominoplasty if needed. And we're seeing with the MRI results from these patients who are asking, well, do I really need to have surgery? You can do a physical exam, you can also do, of course, the radiologic exam, and they're seeing that oftentimes either they don't have to do as big of a procedure or that the suture actually holds better inside the thickness of the muscle that's there.
Interesting.
So something that I thought that was a little bit unique. What did you guys see in Arizona? Same thing?
Same thing, and the preliminary data through MRI on diastasis recti is showing an approximate 11% reduction. In the photography and the patients that I've been treating I've got patients that are almost 3 years post now. I would say it's definitely a bell-shaped curve because you have patients that have a more significant reduction. And more importantly, it's not even, I think we tend to focus a lot on the cosmetic. The thing that is incredibly unique with this procedure is it's not just things look better, but patients consistently feel a difference. This is the type of treatment that you feel a difference, you can see an improvement in posture, especially with the glute treatment. There's actually a functional change, and I will tell you, patients really appreciate that because this is a cosmetic focus, but a lot of these patients are very active, and when they see a functional change, that can be really dramatic.
That's really interesting. That's really interesting. What would you say, you see an average patient, they come to you, what do you typically tell them? How many treatments does it take? Is there any downtime? What's the typical scenario?
With the protocols that we started originally, we were doing 4 treatments, 6 treatments, 8 treatments, even up to 12 treatments, 2 a week, and separated by 2 to 3 days. We found that the ideal sweet spot, and again, we're in medicine, right? So everybody's going to be a little bit different. You have to pay attention to that patient, do a physical exam, and make sure they're going to get the best results with what protocol you start. But on average, we found that the sweet spot in the bell-shaped curve that JD was talking about is really 4 treatments over 2 weeks. Okay. So you come in twice a week, and you want to separate it between 2 and 3 days. And if you look at muscle physiology, and JD is the better person with muscle physiology, you can see that ideal time to recover some of that muscle and get the best results from it is about 2 days.
I see. And is there any downtime associated?
Zero. Absolutely zero. And the best part is, this is what I see. We had a dermatologist in our local neck of the woods. He came for the treatment. He just wanted to try it out. He had a second treatment, and he calls me that week, and he's like, Sunil, I feel like Superman. Like, I feel so strong, and I feel like I've been going to the gym for 3 months instead of 2 weeks. I always make people go to the gym for about 2 weeks or 3 weeks to show that they have commitment before we put them on the machine. Because again, we want to partner with patients and make sure they have the best results.
Interesting. Yeah, I was walking to the speaker ready room and I saw another room with people trialing M-Sculpt. And I was like, maybe I'll just pop in there for a minute and see how it feels. Because when you look at it, you can see it working. I mean, you can really see the device.
You can see the muscles.
It's not a subtle thing.
There is an intensity to it.
Right.
It is an intense contraction. It should never be painful. Meaning we go to the threshold that you can tolerate with intensity, and it should feel like a little bit of a workout. To me, I don't really want it to be a relaxing treatment. I want them to really be able to focus and feel that contraction. But I encourage you to go and try it, because once you feel it, you'll understand, okay, this is not like anything else you felt before on your muscles. Because I've treated a whole spectrum, and patients that are extremely fit, extremely muscular fit, and when they do this treatment, even those patients are like, oh my gosh, I have never felt my muscle contract in such a way, and it's because it hasn't contracted. We're initiating a supramaximal contraction that is beyond what you can do through normal physiology, and we're pulsing at 32 hertz.
Wow.
So you're doing 32 contractions in a second. That's amazing.
Well, and that's only 40% of the actual potential of what we can do with that device.
Oh,
so
I see.
It's
so
actually
not even cranked up all the way.
No. And one of the side effects that I thought was very, very interesting is what you can do with back pain, with shoulder injuries and other areas that are injured. We have several patients that came through because one had a paralysis on one side of the leg. So we're rehabbing the entire leg, the thigh, and both the front and the back of the thigh to actually rehab it and get her back to walking. And at the beginning, we were only doing 20%. We've gotten her up to 40%, and now she's walking without a limp 6 weeks later.
Wow.
And she's been in physiotherapy for over a year trying to recover that leg. So it's pretty neat.
It's amazing how, in plastic surgery, we focused a lot on removing fat, and that was always, and we got pretty good at that. We have liposuction, cool sculpting, all these Kybella, all these different modalities, and And now to be able to remove fat and build up muscle is really game changing.
We're addressing 35% of that canvas that we never did before.
That's amazing.
Right?
Well, sign me up.
It's a pleasure. Nice talking to you.
Thank you guys.
Thanks
Thank you guys so
having
much
us.
for being here and telling us about the technology.
It's a pleasure.
Thank you. Next, we are going to be hearing from one of my colleagues from New York City, Dr. Laura Devgan. She's a plastic surgeon, board-certified plastic surgeon in New York City, and look forward to hearing what Dr. Devgan has to tell us.
It's now my pleasure to introduce Dr. Laura Devgan. Dr. Devgan is the CEO of Dr. Devgan Scientific Beauty. Dr. Devgan, hi, it's a pleasure.
It's so nice to be here.
What brings you to the aesthetic show today?
Well, I was speaking in the keynote on generational aesthetics, and as a board-certified plastic surgeon and the chief medical officer of Real Self, this industry pertains to me a lot.
So we're going to speak about the introduction and advances in facelift and surgical and non-surgical approaches. Everybody has a different opinion. So as a board-certified plastic surgeon, how do you make the differentiation? I know it's not, it's a lot easier on the surgical side because you're the go-to person as the surgeon. But on the non-surgical side, you could have mid-level providers and ancillary providers that are under your direction handling that. So why don't we speak about how you make that decision on behalf of your patient?
So I think the key thing is understanding a patient's unique anatomic characteristics and their goals and expectations for a procedure. And if you do that, then you're golden. The nice thing about where we are in 2019 is it's really a continuum between fillers and facelift. And we have these minimally invasive, non-invasive modalities for younger patients with less laxity, with fewer concerns. And we have the major surgery for patients where the concerns are more major. And the way I kind of look at it is the way cardiology has transformed our approach to cardiac surgery. There are still patients who have a heart attack and need a bypass surgery and get their chest cracked open once they head to the ER. But if you have a heart attack today, there's a good chance that you're going to be able to emerge from the hospital a day later with a little groin incision and a stent. And that's kind of what injectables have done for not everybody, but for a large percentage of the population.
Injectables help, all right? It gives you a more immediate refreshed look, but sometimes you're going to need more injectables as maintenance.
You get the puffy filler face.
All right? Well, not even like that, but I've got the event. I can't get a facelift because I've got a reunion or a wedding. I need the fillers, okay? And some of them are longer term. How do you determine whether or not you want the shorter term, the longer term, or the traditional facelift?
I think part of that is understanding the patient's expectations and their time frame. One key rule of thumb is understanding that if you have more than a centimeter of pinchable laxity in the mid-face, the jowl, or the neck, you're going to graduate from what injectable fillers are capable of. And there is this tendency in our industry, and I'm sure you would agree with this, sometimes people think that more and more filler is going to add up to more and more of a result.
Correct.
But the truth is, it's kind of like a pencil and a pen. If you press harder with a pencil, you'll get a darker line, but it is not going to become a pen. It's just a different category of result. So at a certain point, you do need to call a spade and say, you know, you've got this pinchable laxity, you have malar descent, you have platysmal banding, submental fullness, jowls, you have these stigmata of facial aging that are really going to be best addressed surgically.
And some of these fillers now that are talking about fat reduction in the submental area and under the chin are trying to take the place of traditional surgery. And really, your opinion on, does anything really take the place of surgery?
Surgery is the most invasive result and also the most aggressive result, and you're going to get the biggest correction and the biggest bang for your buck. On some level, even though a facelift is a very expensive operation, it's still the most value proposition operation or procedure you could have. That being said, I actually am a huge believer in the power of injectables, and I think that you can get a very beautiful and transformative result when they're done right if you manage someone's expectations properly. But deoxycholic acid to dissolve submental fat. We can use high G' fillers to create a cheekbone sculpting, jawline sculpting. And there are procedures today that really were not possible a decade ago, like non-surgical rhinoplasty, tear trough augmentation. Right. You can create a little bit of the feeling of a medicalized, three-dimensional type of makeup.
More is not always better, right?
No, more is not always better. It's like, I sometimes think of it as the pizza rule. Like, it's okay to throw a little bit away. You don't need to just throw a lot of product in someone.
Eat until you're no longer hungry, not until you're full.
Exactly.
Right? Okay, Dr. Laura Debkin, thank you so much.
It's
been a pleasure having you today.
So much fun.
I really appreciate it. Thank you so much.
Of course.
Okay, well, that's going to be a wrap for this morning, and we will be having more live interviews later today.
Thank you for joining us. This is Dr. Perlman from Toronto, Canada. Pleasure to have you with us.
So nice to be with you.
Really exciting stuff you're doing. I know you're you've given and are giving a number of talks here at the Aesthetic Show on different facial contouring with injectables, and this is a huge area for patients. I mean, patients, you know, their social media influences, they're seeing their celebrities getting jaw contouring, lip filler, and they want to have that look. So tell us a little bit about your practice.
Sure. Well, as we were discussing, my practice is a little more integrative perhaps than the average practice, as I wholeheartedly believe in beauty comes from within. So I do focus on things like nutrition, general health, but as well as skin health, vitality, and aging. And through my now almost 2 decades of work in cosmetic medicine, I've had the opportunity to really curate expert technique and approaches, whether it's using needle-based technologies, skincare, or the exciting new options with no to minimal downtime that we can use to treat patients.
I think that's the key thing. You know, patients are interested in, you know, looking better.
Yep.
With, as you're saying, little recovery, little downtime.
Yep.
They don't want pain. They don't want bruising.
And we didn't share our age, but we are so lucky because we're living in an age where kind of the scalpel, I know you're a plastic surgeon, so I won't say it's a thing of the past, but there are fewer and fewer indications where surgery is the only option, and more opportunity to use things that, like we just said, may have no to minimal downtime. Safety, cost to the patient is like way more accessible.
Right, I completely agree with you. You know, even in plastic surgery, we talk about the treatment gap. And basically, you know, there are young patients that can benefit from things like, you know, Botox and filler and skin care. Older patients, oftentimes they have skin laxity that needs a surgical correction. There's no other solution
The sooner
for it.
you start, the
Right.
more likely that non-surgical options will continue to be dramatically effective for you and that best option. But I would say that when we think even before the needle or the skincare that we're using in the clinic and actually think about what's going on in the inside, genetic susceptibilities to aging, that was a talk I just gave on the gene basis of skin health, facial appearance, and aging, we can be dramatically proactive about how we look, how we feel, how we age. And like you said, I mean, for me, you asked me what I do, I always just work one patient at a time, helping each one of my patients to live their best life. And I think as it relates to beauty, what I would say is that to me really means this very bespoke or personalized approach, no cookie cutter treatments, but delivering best technique, best technologies, best treatment options to help each and every one of our patients look and feel and age their best. And so whether it's the lip, I mean, you talked about 2 of the hottest treatments, right? You talked about like lippies, right? Lip injections. If you just hashtag the word lip on Instagram, you'll get more options than any other hashtag, right? Thanks to Kylie Jenner, the Kardashians, right? And also really the idea that we have this very accessible option. I don't know if you've seen, there's YouTube videos now of influencers and beauty bloggers doing it at home. So, I mean, it's not that accessible, but accessible enough that, as we discussed, no downtime, right? Very accessible in terms of price point, where whether it's enhancement or an enhancement and a rejuvenation, our patients have this option that wasn't always available.
Right, and it's, I totally agree with you. Tell us a little bit about personalized treatment, because I think it's an important point. You know, Different marketing companies and different skincare companies, for example, you see proactive ads
Yes.
online, and you see different skincare lines that try to kind of send you the package.
Yeah.
And it may be attractive to some people because they see influencers and advertisers kind of saying, this is my before and after result, but it may not apply to all patients.
Well, I would say the concept of bespoke beauty or personalized care is really about you as the provider and me as the expert provider. I mean, it's about our ability, not one test, one treatment, one product. It's about our ability to listen to, assess, and understand the unique needs and goals of each one of our patients. Again, that is personalized care in a very intimate relationship. I mean, we as the ultimate providers need to be having that conversation that deep. It is time consuming, but it's that consult where we can conjure up the personalized plan. I use another word to describe this sort of new frontier of precision medicine. And when you marry personalized care with precision medicine, which may imply that we are looking at, I mean, in my practice, genetic susceptibilities, hormonal risks, nutritional risks, or other factors that are true biomarkers precisely applicable to this patient that we can harness in making a personalized and precise treatment plan. And I guess the last concept there is what we were chatting about, which is that we are lucky enough to be aging in a time where we can be proactive in our health and our aging.
Right. It wasn't available previously. I mean, all these.
Not in the same way. I always say grandma could age gracefully, but we can be proactive, right?
Right. So in your practice, who comprises your practice? Who are your patients typically?
I think because of my persona and my expertise in women's health, I ran the largest menopause clinic in Canada for 10 years and run, as you described, a concierge women's health clinic as well. I do see predominantly women. For beauty, I do see men, whether it's the partner or men who, because of their work and their sort of network, are perhaps more concerned. But for me, I'd say 90% female. And there's two major groups in my practice. So I have my Instagram follower, millennial, who's looking predominantly for enhancement. Although, as you may know, we peak, men too in some areas, but we peak at 26. So the millennial age range, that's sort of smack in the middle, right? So what that means is that although some of our patients in their younger years are coming to us for enhancement, treatment options, we always want to be thinking about their unique age-related needs, because again, rejuvenation and enhancement are not the same. So beyond the millennial, social media savvy type of sophisticated younger consumer, I have a very large, I'd say by number, the bulk of my practice is the early 40 to mid 60. I know that encompasses sort of two different demographics, but empowered, often professional woman who is doing it for herself, for her career, for her vitality. I love that word, right? It implies so much more than the absence of sickness, how they look, how they feel. It's not for him, right? It's for how she feels every day in the workplace, with her kids, with her girlfriends, in her jeans, right? So in that cohort, it is a cohort where the first thing they always say is, I just want to be me. I don't want rubber duck lips. And I'm like, I know. And I'm extraordinarily conservative with them. And I use a language I've used with you here today, which is, let's be proactive together in a personalized, conservative way and help you live your best life. Like, why wouldn't you? Right? You eat well. These women I see are, most of these health literate, beauty literate women are already doing the basics, maybe not the specifics, but the basics of healthy living. This is just that next layer, right? Our skin's our biggest organ, and as I discussed in my last talk, our face, our skin, and facial features are literal phenotypic biomarkers of our aging.
Right.
So we better care about what we look like.
Yeah, I think you're right on. I think the holistic approach, the personalized and precise approach to patients is really where everything is moving. And with new technology and diagnostic tests available to us, we can really just like you said, precisely
We're
identify.
so lucky, right?
Yeah,
It's such a great time to be helping patients age well. And you know, it's funny, I'll have women come in and, you know, maybe a breast cancer patient who's seen for a health need, or, you know, someone looking for health optimization. They may not even know of the other side of the practice, but as I often describe, they're just two different sides of the same coin of healthy, beautiful aging. So yeah, we're lucky.
Thank you so much. It's really
so nice
a
to
pleasure to learn from you as a pioneer in this area.
Thank you.
Thank you. Next we have Carl Thornfeld speaking with us. Very excited to have him. He's the Chief Scientific Author of Episciences. Very nice to have you with us.
Good morning. How are
Good
you?
morning. Good morning. So tell us a little bit about your company and what you guys do.
Our research is based on breakthrough research that was done in the 90s showing that the vast majority of skin abnormalities that we see with skin aging and skin diseases is actually driven by two major factors: a disrupted stratum corneum barrier and then the chronic inflammation that triggers. We found that there were 7 pathways of inflammation in the skin, and unfortunately things like antioxidants only block 2 of those 7 pathways. In addition, we found to repair that barrier, we had to optimize 5 different pathways there. So it made it very difficult as far as finding synthetics that we could actually work on that. And so we went to the herbal arena, because with herbs you get not only the specific active anti-inflammatory effect or anti-proliferative or antimicrobial effect, but you will also get an entourage effect that improves stability, produces synergism, and improves the safety of the active ingredients. And so we have done a lot of work in the area of herbal medicine and found that in fact that many of our formulations, actually 10, have beaten prescription gold standard products in double-blind prospective controlled clinical trials using the finished product. And no other cosmetic company can make that claim. There were 2 other companies that tested against one. We've taken on 10 gold standards and beaten them all in efficacy and safety.
Interesting.
And our most recent was last October against an acne drug, the clindamycin benzoyl peroxide combination, which has been shown to be not statistically different from the clindamycin tretinoin combo, and yet we were statistically significant in 1 day in superiority, and by 6 days statistically superior. So faster, stronger, more effective, and yet 78% of the patients preferred our formulation using several. We did 6 herbs combined with 2 over-the-counter FDA acne monograph drugs, but we manipulated those ingredients to make them much more effective.
Wow.
So we've shown that herbal medicine has a great future, and we do actually have ongoing research now in 3 continents going as well.
Wow. That's fascinating. I mean, you know, I think we're going through a trend or an evolution, I should call it, where we've been deeply entrenched in synthetic medications, lab created products and chemicals. And I mean, I can speak for myself. You know, I have 3 young kids, and my wife is very focused on the safety of many of these devices. I mean, efficacy is one thing, but even just the basic safety of some of these preservatives and chemicals that are in our products that we use every day. What herbal treatments do you think are most successful in your skincare products?
The first one was our anti-aging, where we took on prescription Renova, 0.05% with its lactic acid, and we were twice as good in dermal thickening, and we had no irritation. So we exploded the myth that you have to have pain to induce gain. We also then have this, the acne one that I just mentioned. We also have the first true multivitamin that modulates all 24 vitamins and that contains those and the mechanisms to induce that, the further synthesis for the entire epidermis, from stratum corneum down to basement membrane zone. Because when we're asking the skin to rejuvenate, we need to have the nutritional background to be able to do that. And we found in doing that concept that in fact nutrition is vital. In 1 week, we had highly statistic resolution of fine wrinkles within 1 week. By 8 weeks, we had a 57% decrease in fine wrinkles, and 46% decrease in fine lines, 32% decrease in coarse wrinkles, which, as you know, in anti-aging medicine, it's unusual to see anything in the dermis until 8 to 16 weeks.
Right.
But we saw it very early on in the stage. So indicates again that the nutrition is important. And incidentally, those highly statistical superiority results, one was against a growth factor combination, another was against an antioxidant combination with high amount of vitamin C and E and other antioxidants, and were clearly superior. Matter of fact, the dermatology investigator who's gotten multiple drugs approved through the FDA said this was the most powerful single product he'd ever seen.
Really? Wow, that's fascinating. I mean, I think one thing that strikes me is that the amount of research and effort into looking at before and after outcomes and efficacy is really commendable, because there's so many skincare products out there, and from a plastic surgeon standpoint, when you look at a before and after photo, you can immediately tell which one had the lighting changed, or which one may have even been altered, and it can be very deceiving to the consumer, because they're seeing a before and after photo and it looks better, but that doesn't necessarily mean the product works better. And you're talking about specific percentages and specific improvements. What I'd like to know is, let's say I want to get a patient on your regimen. Is there a basic package or a basic array of products that you would recommend to start on, or is it specific to a certain concern, or what's your suggestion as far as that goes?
As a general rule, we need to use the barrier-repairing anti-inflammatory renewals as your base. You need to be using sunscreens that are anti-inflammatory, don't damage the barrier, don't have irritation with them, and are anti-pollution, and we have both of those. In addition, we need to provide the nutritional background with the serum product, but then the other adjustments depend on what the underlying problem is. Keep in mind, patients come to us skincare professionals, they have expected us to be a clearinghouse. What's safe and what's effective? Just like the decisions we make for the prescription products or the devices that we use. They all have safety and efficacy, and yet in cosmeceuticals that's not required.
Right.
And yet I believe we have a moral ethical obligation to in fact prove that with safety and efficacy studies using the finished product, and that's very important that we do that. So for example, a person who has hyperpigmentation, we have a product that is an intensive nourishing cream, which is focused more on the hyperpigmentation. If they have rosacea, we have a product that is a little bit more selective for that. So it depends on what we're trying to accomplish, but at the end of the day, all these products are focused on reducing inflammation, optimizing barrier function, but also killing pre-malignant cells. I mean, my major driver for this, when I moved into the high desert area where I was the only dermatologist for 30,000 square miles for 32 years, was I saw so many young people with cancer. And so it was really focusing on what was skin cancer, what drove skin cancer, and that's where our initial research began. It was during our pre-cancer studies that then patients would come back 6 to 12 months later and say, hey, I need more wrinkle cream. And so then we thought, okay, Dr. Kligman developed Retin-A responding to patients' concerns about, oh, my wrinkles are getting better when you're treating my acne. So we went ahead and looked at it, and sure enough, we ended up being twice as good as the gold standard in reversing wrinkling. But the main strategy was to make that skin as healthy as possible to prevent the pre-cancer formation and skin cancers.
It's a great point, because many patients don't use sunscreen. We're becoming more and more susceptible to sun damage, skin cancers, and being proactive and preventative in those areas, and really making sure that the products are dealing with those. And I think what you said also about holding ourselves ethically accountable, because in these areas, the vitamins and supplements, patients don't know this, but there's just no regulation on it. So I think it's very important that we hold ourselves to that standard.
Yeah.
So,
last year a study was done where 40% of the cosmetics claiming retinol had no measurable retinol effect.
Wow.
Okay. So the other thing that's important about the barrier, though, remember, sunscreens bind to the skin barrier. So if that skin barrier is not intact, then the sunscreen ingredients are absorbed internally. Okay, they don't stay out in the layer of the skin. So barrier is very important. It's also in 2016 been shown that airborne pollution actually triggers pathway that activates skin cancer more than twice as bad as ultraviolet light. So we have to take into account, we need that intact barrier to keep out the pollutants as well as reduce the ultraviolet light.
Well, I've learned a lot from you, Dr. Thornfeld, so thank you so much for being with us. It was really a pleasure.
Thank you so much for taking the time for me today.
Thank you.
Bye-bye.
Thank you. Next, we have Dr. Tess Mauricio coming to speak with us about, she's a board-certified dermatologist, and very excited to have you with us.
Hello, Erez.
Hello.
Great to be here.
Thank you. So tell us a little bit about Beauty by Dr. Tess.
Well, Beauty by Dr. Tess, the goal is always to get our patients feeling and looking their very best inside and out, and utilizing the latest technologies and my expertise to really put that all together. The goal is really building the patients from within.
Well, I have to say, everyone assumes that plastic surgeons like myself know a lot about skincare. I just had a patient text me, what do you think about this dark spot? How can I improve it? And the reality is, the dermatologists are the experts in this area.
Wow, I can't believe I'm hearing that from a plastic surgeon.
Yes.
That's really big of you.
And I think it's important because, I can fix jowling and I can fix soft tissue descent and, shape of the nose and different things, but really skin, I make the analogy of a car. You bring your car to the shop. If your car came in dirty and, there's spots on the paint, and you bring it out and it looks the same, it just doesn't drive as well.
Absolutely, and I think, when we think of youthful look and youthful appearance, the quality, the texture, the coloration, the luminescence of the skin really makes a huge difference in how, we can kind of pinpoint patient's age. And dermatologists, obviously, we are real experts at it, and and I think we should be leaders in skincare.
Yes.
And but my practice has gone beyond just the skin. In fact, I just finished a lecture in regenerative medicine and the use of combination protocols for treatment of the vaginal area, vaginal restoration and rejuvenation. So utilizing our expertise as dermatologists, utilizing biocellular medicine and applying that to the vaginal area, it's been incredible and life-changing for my patients.
Absolutely, I agree with you. I mean, in our practice as well, the areas that we're treating continue to expand, and the trends are evolving, and it's very important for doctors such as yourself to come to these conferences.
Absolutely.
Not only to teach, but also to see what the latest trends are, what other people in the country are doing. So tell us a little bit about your practice. Where are you based? What is your average, what is your typical patient population?
So I founded M Beauty Clinic, and we have 3 locations in San Diego, in Chula Vista, and in Beverly Hills. And again, it's comprehensive, and we are leaders in non-surgical rejuvenation, cosmetic dermatology, and now regenerative medicine, and also women's health. And we have incredible technologies that I am very honored to have helped pioneer. And patients are really coming in now in a single visit, in a single harvest of fat. We can treat their hair, we can treat their face, we can treat their hands, and now we can treat the vaginal areas as well.
Yes, I think the holistic approach is what patients are looking for now. It's less of just pinpoint the specific area.
Right.
It's just overall wellness and rejuvenation.
It's global, it's holistic, and how I look at aging, it's really inside and out. It's really about what we're doing to the skin, but also, we also utilize stem cells. We also talk to our patients about nutrition, nutritional supplementation. My husband and I created a nutritional supplement line called Lively. And so everything works, and everything has to work together, but we live in an exciting time where it's our choice. We no longer have to accept looking old and feeling old.
Right, and with new technology, I mean, it's really amazing how we're able to diagnose and pinpoint very precisely patient issues and how to address them.
Correct, and many times it's education. When patients come in, they don't really know what's available. They don't really know what we have to offer them. And so it is our responsibility as physicians to educate. So a lot of times during consultations, educating patients what's available, what can we do to treat their problems, and ultimately improve their quality of life.
who would you say is your typical patient? Who seeks you
Yes.
out of the population usually?
So I think because I'm a dermatologist, patients will come seek me, go to see us. Mostly they're postmenopausal women. They want a non-surgical, natural approach to anti-aging because that's kind of what I'm known for.
Right.
And so they'll come in and we probably will start talking about their face, their skin, and then these are the same patients that also will have issues with maybe thinning hair. They'll also have issues with incontinence, dryness, pain. And so the conversation goes well beyond the skin of their face.
Right.
And then we'll start talking about these biocellular regenerative medicine therapies like platelet-rich plasma. I pioneered a procedure, combination procedure called the time machine procedure, which includes energy-based resurfacing, platelet-rich plasma, microneedling, injected intradermally, applied on the skin, and the ALMI procedure, which is an acronym for autologous lipocyte micronized injection, harvesting biocellular product to use all over. And so we talked about those kinds of procedures, and patients are very excited because they want to use their own product. They want the natural rejuvenation.
Right, it's so interesting you bring that up because the last interview we had, we were really talking about a more, not only a holistic approach, but a more natural approach.
Correct.
And I think it's such an important thing. We're going through this evolution in medicine where, we started off, at least I can speak to for plastic surgery,
Yes.
with a lot of synthetic products, hyaluronic acids, silicone, and it works to achieve some of the results we're looking for. But if now with newer technology and newer techniques, we're able to use natural products and even products specific to a patient,
Right.
It's a real game changer.
Well, for example, the ALMI procedure, not only are we correcting volume loss, but we are also activating their natural ability to heal and regenerate. So not only do we see kind of recreating the structure of their faces to help some sagging and wrinkling, but we also see improvement in the quality and texture of their skin over time. And so patients love that, and that's what I love for myself. I'm 48 this year.
No way.
And I practice what I preach, and I think, I've been in practice long enough now, and so patients that come see me, they're like, we want what you're getting.
Yes.
And so it's sort of selfish for me to try to find the latest and greatest, but I find that when doctors apply these technologies to themselves, they become more passionate about it. And so I encourage all of my colleagues to try these incredible technologies and be an advocate for yourself and for your patients.
Well, if you're 48, I want you on my website.
Thank you.
Thank you so much. It was
Erez.
really interesting to hear everything everything you're doing and all the innovative techniques and technologies.
It's a great time.
Thank you very much. So this is the conclusion of our session. Thank you so much for having me as your host. There will be more interviews with some of the leaders in aesthetic medicine and surgery at this great meeting here in Las Vegas. Look forward to seeing you soon. Thank you.
Bye.